Hi, Gatimu. I can hear you. Gatimu? Hi, Gatimu. I can hear you. Gatimu? Hi, Gatimu. I can hear you. Hi, Gatimu. I can hear you. Gatimu? Gatimu?
Morning, my customer. Hi, customer.
Hi. Hope everything is well. We were supposed to have a session today, and the panelists or the medical doctor or the medical psychologist is finding it hard to log in. So we'll wait a bit more. If we can't make it today, we'll reschedule maybe for next week. So we're still waiting. Hi, Daniel. Hi, Daniel. Hi, Daniel. Hi, Daniel. Wait, sorry.
I'm trying to connect. I don't know what is going on. I can see you. Can
hear me now.
Can you hear me?
Yes, I can hear you.
Hey, Jesus. Baba, we thank you.
Hopefully now you can hear me. Yes?
Hi.
I can be heard.
Can we try without the earpods? If the sound will be audible. Can you now try again? Hi, Gatimu. Gatimu. Can you hear? Hi. Can you hear now? Is it okay?
Okay, I think I can hear you. Hello?
Hi. Hi. Yeah, I can.
Right now.
Yes, I can.
Okay, what about now? Let me. I can't hear you. That will make sense. I just put. Okay.
Can you hear me now? Can you?
Okay, let me kidogo tu. Then I see if I can hear you.
Okay. Try again.
I can hear you. Yeah, can you hear me?
Yes,
Because I
I
can hear
can.
you. I want to know if you can hear me. Okay, maybe we can
Yeah.
start. If I'm audible now, okay. Thank God it worked finally. Because I was like, what is going on? The entire process.
Hi. Hi. So,
Oh,
yeah.
mhm.
You can't hear me?
I can hear you clearly. Okay.
Okay. So, we are going to start. Sorry, guys. It's been some minutes. We have been trying to set it up so that we can start, but better late than never. I'm Velin Migoi. I'm a counselor by profession. I'm an online educator, and today we are going to discuss more about uh, depression. So the other time we talked about depression, Daniel was trying to explain different things about depression, and we decided we'll just go on with the topic. Even next time, now that we won't take long, uh, we won't take the much time we were supposed to take explaining because time has really gone. And due to other commitments, we can't have the full session. So, yeah, uh, Daniel, you can
Yep.
take it over kindly.
Okay. Yeah. Whenever you don't hear me or whenever I buffer, let me know so that I can know what to do. So,
Okay,
I think. Thank you. Thank you for that. I'm really sorry for being late. I think network problem and the issue of technology there was really stressful in the beginning. Today, I want us to understand something about depression more and more, some of the factors that we need to know. At the same time, because of time, also wanted to talk about the spiritual factor that can or support basically faith and depression, and also a little bit about depression and technology as a factor as well as well. But before we do that, it's important for us to know what is depression. I think depression is one of the common and serious mental health disorders that negatively affect people. It affects your feelings, affect how you think, it affects how you act, and it can lead to emotional or physical problems. People don't know about that because some of the people that I've seen, uh, they come with a physical problem, but they have emotional problem that are, or psychological problem that need to be solved rather than physiological problem. At the same time, it can decrease personal the personal ability to function at home or at work. At the same time, it can bring sadness. Uh, Depression can be a, a problem to you, especially if it starts. It can persist for weeks, for months, for years, and especially if it remains untreated. Uh, the reason I say it can remain for years is because this type of depression that we call dysthymia that can stay for at least 2 years. So for us to say a patient has persistent depressive disorder or dysthymia, we normally look at criteria that have been a patient has been experiencing some depressive features for at least 2 years. There's other type of depression, and maybe I can explain them. There are six before I go on with cause or risk factors that cause depression. I think number one is major depressive disorder. As a type of depression that characterizes sadness and the loss of interest. Most of people experience sadness, but now the difference between sadness and depression that is that persistent sadness rather than temporary sadness. Because temporary sadness can happen where you're financially disabled or you have difficulties in it. You can feel lonely after some words, after some moment. For example, if somebody closer to you left, you can feel discouraged when somebody says some few words, but it's temporal. But for the case of depression, it has to be persistent sadness and loss of interest in activity. We call it anhedonia, where you can lose pleasure or interest in activity that you normally used to do. If people used to go for swimming, for example, every weekend, you find yourself you can't go, not because of other factors, interest in swimming, or you have lost interest or pleasure in doing whatever things you used to do. So number two is persistent depressive disorder. We call it dysthymia. This is where you exhibit depressive symptoms for a longer period of time. Can be at least 2 years, but it can be more. The third one we call it bipolar, part of mood disorder. We have manic depression, where a person we call it bipolar one, where you exhibit more of a depressive disorder more than mania. Or at the same time, you can experience depressive symptoms without mania or hypomania. Makes sense.
Mm-hmm.
But seasonal, I don't think we have it. Seasonal affective disorder. It's not mostly in Kenya. We do experience seasons most probably. Like we do experience harsh winters or harsh summers most, but seasonal mostly affect people who experience harsh summer and harsh winters. But the last two also important postpartum, especially happen to women after giving birth or after child delivery. So it's important for our emotions, especially after giving, so that she can protect herself from having postpartum depression. What else also to discuss and know is we call premenstrual dysphoric disorder. This is a type of depression where it happens when you have severe form of menstrual where either your menstrual period or menstrual is very painful. At the same time, the mood swings are very kind of fluctuating much more. Most of the people think mental disorder is not part of illness, normal illness, but mental illness is as important as physical illness. Why? Because they're not caused by stress alone. Stress is just a fact problem. When you have hypothyroidism, probably you will exhibit depressive symptoms. And when you have hyperthyroidism, you're more likely to experience uh, anxiety symptoms. So change of hormone, change of uh, chemical imbalance in your brain, or serotonin, dopamine, and norepinephrine in your brain, they're more likely to cause depression. So number one thing that I'd like us to know is not a must for you to be undergoing a major depressive factor, but because of change in your brain, change or rather medical condition that you might have, it can really cause depression. And a clinical depression, not just depression, or depressive features. The other part is genetic. If you have a family history of depression, it increases the risk of you having depression as a child. If your parents suffered from severe depression, you're more likely to to, to be susceptible to depression most of the time because of genetic factor, most probably. That is it. And then we have psychological factor. And with psychological factor is where now I wanted us to talk about some main other factors apart from negative negative thoughts, ruminating thoughts, low self-esteem, and a history of trauma or abuse, especially under history of trauma and abuse. I wanted us to talk about a little bit about technology because today we are experiencing about technology that has really provided an opportunity for us to grow either financially, knowledge in terms of information, insights that we normally have. But sometimes you can experience trauma or abuse via the social media platform, and it can change your psychological way of thinking. It can actually affect your core belief as a person. It can bring something we call cognitive distortion within your mind. And it's important for us to understand. Yes, there's uh, myths about technology. At the same time, we have disadvantage about technology, and one disadvantage is causing mental health conditions such as depression, and especially when you have excessive social media use, you might end up having depression and anxiety, comparison and everything. I think research has been done, especially in America, especially America academia, about they did something about kids and children having spending more time or having a lot of screen time in social media and something, and then they end up having depression, anxiety. It makes you susceptible to that because you might experience cyberbullying, you might experience online harassment, and this can lead actually to severe distress or mental distress among adolescents, adult people, also younger youth. It happens. Of course, we have benefit of technology such as sometimes you can do teletherapy or online therapy and really work. Sometimes you can have mental health apps that can really support our mental health. At the same time, we have artificial intelligence that are really working right now, like ChatGPT. You can also get a lot of materials such as CBT materials that can help an individual to to cope well with the mental disorder. Apart from that, while technology presents challenges, it also prevents some good things. But that's why I want us also to focus on their benefits. We don't do away with the technology, but we need to understand that technology consumption can really ruin your life. So when you're consuming digital information, be mindful of technology because they can really interfere with your mental health. I've had a lot of things. Let me use this example that I normally use, where if you're a guy and maybe you have undergone a breakup, you can find a text or a quote via the Twitter where people say, all women are the same, or bro, be careful, they don't love you, or something. Or at the same time, you can get quotes and passages and comments where they maybe show you how women are bad. At the same time, if you're a woman and you have undergone an heartbreak, you can go via Twitter or via X or Instagram or Facebook, and you can really find comments and quotes where they describe the other gender or male as really bad people. So one of the things that you need to know, especially with your mental health, when you undergo something, I don't think social media platform IG or X is kind of very good for you to get good material because the disadvantage of that. So sometimes you have to be very mindful and strategic with
Mm-hmm.
digital consumption of information because they are core factor today that cause mental disorders. They are the main factors that affect youth and adolescents in our generation today. Uh, Maybe we discuss it later more about it because I have few time. And the other factor is an environmental factor. When you stay in a place where there is chronic stress or you're experiencing financial difficulties, loneliness or lack of support, you're more likely to go deeper into depression. Because let me in layman's language I can explain about how hormonal or brain chemical or neurotransmitter how they work. When you are experiencing stress, first of all are released. Cortisol has to be released at that point. And the way they work after some few minutes or 30 minutes or so, you relax yourself. But I can imagine when you're experiencing stress, chronic stress, And I don't know if I can be heard. Yes. So I
Yeah,
think.
yeah, we can hear.
Oh, okay, thank you for that. So when you're experiencing chronic illness, this is cortisol or stress hormone, they keep being released in your system, and there's no reward system of dopamine or something that excites you or gives you hope in any point. There's no pleasure when you have stress hormone all over your body system every day. So either it can be work, marriage, uh, friendship, or something that provide chronic illness. That could be an environmental factor. Financial difficulties, especially nowadays, loneliness or lack of social support can be one of the factors that causes depression. The other thing that I would like us to talk about is drug and alcohol. It contributes or it can worsen depression. It contributes a contributing factor. And many people use substance or alcohol as a coping strategy. But trust me, it contributes to you being depressed. At the same time, it worsens the depression if you have one, or if you're struggling with depression. So it's very important for you to understand substance is the core thing that you when you're talking about depression. I don't think I should talk about symptoms, but it's important for us to understand some of the feelings. Speak about there is temporary sadness that you normally feel, but during clinical or experiencing clinical depression, we have persist persistent sadness, recurring sadness that you feel sometimes you can feel emptiness within you, hopelessness about future of something that you're looking for or you're hoping for in your life. The world is not a course that you like or activity that you love doing is a sign of that you're struggling. You might be struggling with depression, or you lose pleasure in doing things that you used to do before. Is a sign. If you used to hang out, but currently you're not, sign that you're struggling maybe with depression, and you need to look deep and check yourself about it. You can be irritated. Actually, uh, easily irritated. Where you find your maybe yourself, you easily lose control of your temper or your anger, and you act sometimes or easily roused in anger. It's something that it's one of the signs that shows that you're not okay. The other thing that I would like us to talk about is sleep disturbance. Find yourself you're not sleeping very well, or you're having excessive sleep. Maybe you might be struggling with depression. At the same time, the opposite is correct. You might be sleeping too much and less. Uh, Something I can't forget about talking, which is very important in terms of symptoms. Sometimes you might have suicidal thoughts, thoughts or attempts. When you experience these suicidal thoughts or attempts, please reach out. It's important for you to reach out to any person that you think they can support you. Uh, you can reach out to a hospital. You can reach out to society that support people. so that you can because I believe depression can affect you. Depression can affect you. Can
Hi guys, it seems we will have to reschedule it because Gatimu's network is uh, disturbing so much. So hope to reschedule and bring Gatimu back for the next session, and hope that you will be patient with us on that as we work on different technical issues. Till next time.